I'm going to be arguing that physician-assisted suicide should be legalized, and my 5 claims include personal rights, cost, compassion, mercy, and death with dignity. First of all, my submitted claim is that due to an increasing trend of cancer, which according to the National Cancer Institute, 1,529,560 new cases of cancer have emerged since 2010. This means that there are more people that are becoming more and more terminally ill, and so more people want to be, would want their life to be ended. But maybe I should go back to stating that physician-assisted suicide is not where the physician gives you a direct injection, but simply that the physician gives you the means for you to kill yourself, which is entirely different than euthanasia. Euthanasia is where the physician actually does the killing. On to my first claim is that personal rights is a solvency claim. If people have the right to refuse treatment, then that means that they have the right to do as they please. And if you continue on, so they have their right to hasten their death, which is the same thing essentially as them dying the next day. Because the state and federal constitution states that an individual has the right to make decisions concerning such medical care, including the right to accept, refuse medical or surgical treatment, and the right to formulate advanced derivatives. This means that if a person has the right to enhance their death, to make their death come quicker, it doesn't really make a difference if they're making it quicker by 1 month or, let's say, a few weeks. Lawyer David H. Strauss stated that the principle, treat cases alike, is central to the notion of justice, with justice seen as a distinct ethical value. So it is reflecting basically on what the Constitution stated, was that if one person has the right to do this, then they should have the right to do that for any means of refusing medical care. My second claim is that there's a significant cost to that is occurring because people are not allowed to die sooner. Medicare paid $55 billion for doctor and hospital bills during the last 2 months of one patient's life. So in 2 months, that means that one patient is using $55 billion of Medicare, which is significantly bigger than the budget of the Department of Homeland Security, and is also bigger than the budget for the Department of Education. This also includes more that the government is paying for most of the money, which is coming from our taxpayers' money, because 20 to 30% of medical expenses have no meaningful impact. So basically saying that I'm paying this much money and it's not significantly helping any specific patient. 85% of healthcare bills are paid by the government or private insurance and not by the patients. This is reflecting basically on that the government, which is lower down to our taxpayers, are paying for most of the money for these people that don't even want to live in the first place. My third claim is that it's kind of mixed in with compassion, mercy, and death with dignity. And basically what it states is that people are compassionate. Dr. Dachshund Ketchler of the UC Berkeley Psychologist Department stated that human beings have survived as a species because we have evolved the capacities to care for those in need and to cooperate. As Darwin long ago surmised, sympathy is our strongest instinct. Our society survives because we are compassionate, because we care for each other. We are compassionate people. That it shows why our parents suffer so much to have us have a better life, or why, as for the American Humane Association, 3.7 million animals were euthanized in 2008 based on their inability to live fully to a fuller life, which is just another example of how people are compassionate. And people don't want to see their loved ones in pain. They don't want to see their loved ones at their worst moment, because there are so many different things that happen after you're terminally ill. Whether you have loss of control, loss of dignity, you have loss of normal bodily functions, you are deteriorating in front of your family members, and that in itself is so hard that it would be easier on both the person that doesn't want to live, and it would be easier on the family, so that they don't have to see their loved ones in their worst moment. I wanted to go to our plan of action is based on the Oregon model, in which is based on the October 27, 1997 Death with Dignity Act, which allows terminally ill Oregonians to end their lives through the voluntary self-administration of lethal medications expressly prescribed by a physician for that purpose. The basic requirements for the Oregon model include the person must be an adult, an Oregon resident capable, which means that they are able to make and communicate healthcare decisions, and diagnosed with a terminal illness that will lead to death within 6 months. The second round of requirements includes 2 oral request physicians, which are separated by 15 days to allow time to think it over, 1 written request to a physician with 2 witnesses' signatures that are not family related. A prescribing physician and consulting physician must confirm 1, diagnosis and prognosis, and the capability of the patient, which again is the able to make and communicate healthcare decisions. And the last 2 for the Oregon model is that if a patient has psychiatric or psychological disorders, they must be referred for a psychological exam. And lastly, the physician must inform patients of alternatives such as hospice care, comfort care, and